Good afternoon, everyone. On behalf of Dentium, I warmly welcome you all in today's webinar on Simplified Prosthetics through Digital Workflow. This webinar will be informative and beneficial for those who are planning to start implant practices. We are privileged to have Dr. Avantika Tripathi, MDS Oral and Maxillofacial Surgery and Dentium KOL, as our esteemed speaker, bringing expert technical knowledge and practical insights on the use of Dentium Bright implants. We encourage all the participants to stay until the end of the session to avail webinar special packages and a chance to win a bright fixture in the Lucky Draw contest. Thank you for joining us. Now over to Dr. Avantika.
A very good afternoon to all of you. Welcome to today's webinar on Simplified Prosthetics through Digital Workflow. As we all know that implant dentistry is growing, is evolving rapidly, and with the digital technologies, we can diagnose, plan, and restore our cases very easily. So earlier we used to require multiple appointments to complete our procedures as we used to do it manually. But now the chair side adjustments, multiple appointments are reduced because of the incorporation of the digital workflow. The digital workflow is so simple and easy to use that we can incorporate it, integrate it in our practice in a very simple way. So today we are going to discuss the Bright implant prosthetic components and how these components will have made the digital prosthetic procedure very simple and easy to use. So as we have already discussed in the previous webinars, that Bright implant are of two types, bone level and tissue level. So these are the Bright implant components of bone level and tissue level. The bone level Bright components are these, the tissue level components are these. Now from the initial slide itself, I'll show you how this system has made everything simple and easy to use. If we are going to put a multi-unit abutment or a screw abutment over the bone level implant, then my bone level implant will become a tissue level implant. So all the components, all the prosthetic components that I will be using for the tissue level implant will be used for a bone level implant with a multi-unit abutment, as I have converted it into a tissue level implant, which has reduced a lot of prosthetic component inventory. Next, starting with the bone level prosthetic components. So to make it simple and to reduce the inventory again, the internal diameter of the Bright implant is same, which is 3.33 for all. So irrespective of the external diameter of the fixture, the internal diameter will always remain same, that is 3.3. So any diameter of the abutment can be seated on any diameter implant. These are the basic components which are there for the procedure is cover screw. So there is only one cover screw because the internal diameter is same. So this can be seated on any diameter implant. These are the healing abutments which are there. These are not scannable. These are pure healing abutments which can be chosen according to the location of the tooth. Suppose it is in anterior, we are going to use the narrow diameter healing abutments. If it is in posterior, we are going to use a wider diameter healing abutment. We all know that we can easily, either we can do a single stage surgery or a two-stage surgery. So if I'm going to do a two-stage surgery, first I'm going to put a cover screw, close it with the stitches, call my patient after 3 months, and then I'm going to remove the cover screw and put a healing abutment on the top for the formation of a gingival collar. Adjacent to this bone level implant is a tissue level implant with a comfort cap on it. So the tissue level implant with a comfort cap will look like a healing abutment. So we do not have to do a two-stage surgery in a tissue level implant, as we have already placed a healing abutment immediately after placement of the fixture. These are the impression components. If anybody wish to follow the manual method, the analog method, then they can choose between the pickup or transfer type of impression copings. This is the best part of the system, that is the digital abutment. So The digital abutment is based on the one abutment concept. It is available in two diameters, different gingival height, hex and non-hex. So the main purpose of this digital abutment is that it can be used as a the single abutment can serve all the functions. It can act as a healing abutment, it can act as a scan abutment, it can act as an impression coping, and it can act as a permanent abutment also. There are three flat surfaces on the top portion of these abutments. So when we are going to scan it, we can easily match the data because of the side identification with these flat surfaces. So it makes the scanning very, very simple and easy. It comes up with a delivery holder. So this is the delivery holder. We are going to pick the digital abutment with the delivery holder and we are going to seat it over the fixture. And if you can see, there is a hole on top of the delivery holder. From that, my screw and hex driver is going to pass. I'm going to tighten it completely, and once it is completely tightened, I'm going to twist the delivery holder and pull it. Once the delivery holder is removed, then I am going to scan my digital abutment. So now it is ready to scan. So next component is the TI base. The most best part of this TI base is that it has a margin and it has a side cut on the surface. The advantage of this side cut is sometimes in the anterior region, we feel like the screw hole is coming labially, and we wanted it to shift on the palatal side because the labial screw hole looks so unaesthetic. So this will allow us to shift the screw access hole from the labial to the lingual side. By using an angled hex driver, we can shift the labial screw access hole to the palatal side, and we can approach from the palatal side to the labial screw with the help of angled hex driver. So a tilt of 15 degree, maximum 15 degree, can be created by shifting the screw access hole from labial to palatal. So this is the biggest advantage. So it can be used in the anterior region and it will provide good aesthetics. This is the screw abutment and the angled screw abutment. So screw abutments, also called as multi-unit abutments. So these are available in single size, and these are also available with the delivery holder. We can simply pick it up and screw it inside the fixture, and we are good to go for a full arch case. The angled multi-unit abutments are available in 15 degree. If more angle customization is required, we can use the titanium blank. As I told you that it is more of a digital system, so more of digital components are available. The regular manual components are less as compared to the digital ones. And this is the temporary abutment. If you wish to give a temporary prosthesis to your patient, then you can use this titanium temporary abutment. Complete customization of the prosthesis can be done with the help of this TI blank. So it is a titanium block which can be customized into any diameter, any shape, any angle according to the patient's requirement. So if anterior and custom abutment has to be made, then we are going to use the 10 mm diameter. In the posterior, we need a 14-1, or if more angle is required, we are going to use a broader diameter of TI blank. So angle customization of up to 30 degree is possible with the help of these TI blanks. This is the lab analog. Again, the inventory is reduced here. The manual or the analog method or the digital method, both methods can be performed by using the same analog. This can be used for both manual as well as digital method. Coming to the tissue level prosthetic components, they are quite similar with the bone level ones. The difference is in the comfort cap, as I showed you in the bone level implants, that their internal diameter is same, 3.3. For all the external diameter implants, the internal diameter is standard. Same is with the tissue level implants. As it is a solid implant, it is not hollow from inside, so it has a platform. it already has a healing abutment sort of a structure attached to it. So this platform is standard for all. Even if the diameter of the implant is 2 mm or 5 mm, this platform will always be 3.8 mm, so that any component can be seated on any diameter implant to allow minimum prosthetic components to be like you do not have to keep so much of inventory. Otherwise, if the manufacturer must have thought wisely about the implantologist, otherwise the inventory would have increased too much. This is the scan comfort cap. This comfort cap is screwed over the fixture immediately after placement to prevent injury to the surrounding structures. So this also has to be chosen according to the size or according to the gum, according to the location of the implant. These are the impression components which are there with the tissue level. If you are going to use the manual way, then you can use either the pickup or the transfer impression copings. These are the tissue level impression copings, and this is the bone level impression copings. The tissue level impression copings will also be used in cases of bone level implant with a multi-unit abutment. This is the TI base. Again, the tissue level TI base also has a side cut on it, which will allow us to tilt the angle to up to 15 degrees so that we can shift the labial access hole to the palatal side. This is the digital abutment, which can be used as a healing abutment, a scan abutment. It can also be used as an impression coping, and it can also be used as a final abutment. So it can serve all the functions. So this is the most commonly used and most regularly used abutment of Bright implant. If we wish to give a temporary prosthesis on the tissue level implants, we can use these temporary cylinders. This is the TI blank of tissue level implants. We can customize the angle, we can customize the diameter, shape of the case can be done with the help of these TI blanks. When we are scanning the digital abutment, because of the three-sided design, it is very easy to stitch it, and the data can easily be captured by side identification in these because of the three sides on the digital abutment. So basically, whenever we are going to use the digital way of making the impression, there are two ways of digital impression. Either I can scan with the help of my scanner, or I can make the impression and I can send it to the lab, and they are going to scan it. So first is the intraoral scanning method or the bite tray impression scan method. So in the bite tray scan method, we are going to put the digital abutments and we are going to make an impression. We are going to share this impression to the lab. They are going to put scan spray over it, and then they are going to scan it with the model scanner, and then they are going to prepare, they are going to design the abutments, and they are going to design the prosthesis, and then they are going to deliver it. They are going to give it to us, and we can deliver it to the patient. So the advantages of this this digital abutment is, from the healing abutment till the permanent abutment, all the procedure can be done with the same abutment. We'll see how. This is the TI base, which is used for angle correction. If our screw hole is coming labially, then we can shift it towards the lingual or palatal side. First, we are going to discuss the intraoral scanning method. If first I'm going to scan my abutment with the help of scanner, then I can Suppose I do not have a scanner and I wish to make an impression only, then also I can follow the digital process. It is not required that if I do not have a scanner, I cannot follow the digital process. Still I can. I am going to make a impression, putty impression, and I am going to share it to the lab. They are going to put scan spray over it and they are going to scan it, and then, or they are going to prepare a model and they are going to scan the model with the model scanner. Either they are going to scan the impression or they are going to scan the model. This is called as BTS, by trace scan. Now, what is the main difference between a TI base and a digital abutment? They look quite similar, but there is a big difference between a TI base and a digital abutment. So it is very, very important to understand that these two types of abutments are mainly used for the fabrication of prosthesis in both bone level and tissue level implant systems. If we are going to use this tissue level implant system, TI base, then there is a side cut on it which will allow the access screw hole to be shifted from labial to palatal or lingual side to improve the aesthetics, as I mentioned. If we are going to use the digital abutment, there is no side cut on it, so angle customization or angle change from labial to palatal cannot be done. That is not possible. Second difference is that digital abutments are marginless. As you can see, there is no margin here, whereas the TI base has a margin, so which will help us in seating the abutment, or sometimes this margin is not falling where we want it to lie, so sometimes marginless is better. So according to the case, we can decide if I need to use a marginless abutment, I can choose the digital abutment, because here we can create the margin according to the requirement if needed. Here we have to use the same margin, we cannot change it. It can only be used, the TI base can only be used as a permanent abutment. It cannot be used as any other abutment like a scan abutment or a healing abutment or any other function. Whereas a digital abutment has a lot of functions. It can act as a healing abutment, scan abutment, impression coping, or a permanent abutment as well. We already discussed the use of TI base. It is very, very easy and simple to use in the anterior region, where we can shift the screw hole from the labial to the palatal side. So if we are going to use the digital abutment and we are going to follow the digital method, as I mentioned, either I can use a scanner to scan that digital abutment in the patient's mouth, and then I'm going to send the data to the lab and they are going to process it. Or I can make the impression and I will share the impression to the lab and they are going to scan the impression with the help of model scanner. If I'm going to follow the analog method, I can also take a abutment level impression. So that is just a snap-on impression. I'm going to put the same abutment and I can make a snap-on impression over the same abutment. It is not always required to use the impression copings in this case. If I'm going to use the intraoral scanning method, then over a tissue level implant, first I am going to place a healing abutment, which is a digital abutment only. So right now, this digital abutment will serve as a healing abutment function. Then over the same abutment, I will scan it. So now it will be used as a scan abutment. Then I am going to put a crown over it. Now the same abutment will act as a permanent abutment. If I am going to use the digital method, so if I do not have a scanner and I will take an impression only, then I am going to again put the digital abutment and I am going to make a impression. So I'll just make an impression over it. I'm going to send it to the lab. They are going to put scan spray, scan it, and then they are going to design the crown. They are going to digitally plan it and they are going to deliver the crown so that I can place it in the patient's mouth. So then I can give the final prosthesis to my patient. If I'm doing an analog method, then I am going to place the digital abutment first. Then I'm going to use it as an impression coping. I'm going to snap on impression, prepare a model, and the lab can scan the model. They are going to design the crown, they are going to provide it to me, and I'm going to deliver it to the patient. So this is how I can give a permanent abutment to the patient. There is a very, very important note to be mentioned in this digital abutment part is that it comes up with a white color delivery holder, which is not a scan body. So sometimes we feel like it looks like a white color scan body only, but yes, it is not. It has to be removed and then this abutment has to be scanned. This is not scannable. So if any component is being scanned, it means that that data should have a matching library, digital library also. Then only we can process it digitally. If that component doesn't have a digital library matching with it, that means we cannot process it digitally. So this delivery holder cannot be scanned. It is not scannable. This is only to pick up the digital abutment, seat it over the fixture, pass the screw hole through it, tighten the screw completely, and then twist it and pull it out. This is the only role of this delivery holder. Other role which we can think of with the delivery holder is a snap-on impression. We can put this delivery holder over the digital abutment and we can take a snap impression. So this delivery holder will be picked up inside the impression. Like that, we can make a crown manually, not digitally. So that's all about the digital components of Bright. The Bright implant has come up with a lot of digital options in a very, very simplified workflow. So only one component, as you have seen, there are only 1, 2, and 3. So digital abutment, TI base, and TI blank. Only 3 major components are there, which can serve all the functions. We can do anything and everything with those 3 components. So we have to choose the case wisely. We have to choose the abutment wisely so that we should not face any problem during the procedure. If you want to ask anything, you can ask. That's all for today's seminar.